Colombo, the capital of Sri Lanka, is a lower middle income country that is deemed successful in maternal health and education. Since the 1960s, Sri Lanka's maternal mortality ratio has decreased from 340 per 100,000 live births to just 43 per 100,000 live births in 2005, amazingly saving more than half of the mothers in its country. This great achievement and significant improvement in maternal health is a result of the synergistic package of health and social services targeted for poorer areas in the community.
Healthcare services for mothers and the poor have been prioritized by spending economic and human resources wisely. Women's health are being strongly supported by different measures to empower women through education, employment, social engagement, and offering around 98% of births occurring in the hospital. Gayani, a public health midwife from the military district, explains the education she has received and how it's prepared to deliver quality care.
I'm a public health midwife. Midwives like me undergo an 18-month training program. Each province in our country has at least one regional training center where midwives are trained in child and maternal health. This ensures that they have the appropriate level of care to deliver high-quality services. In addition, the establishment of procedures for service delivery and in-service training makes sure that we have consistent knowledge and deliver high-quality services after completion of our program. We must be prepared to work anywhere in the province where we are trained. This ensures that under-resourced areas are also attended to.
The roles of midwives are extremely important when it comes to maternal care, as each midwife serves a staggering population of 3,000 to 5,000 lives within their local area. They travel from house to house, extending their services to pregnant women, and when they arrive, their duties involve registering them for care, encouraging them to go to antenatal clinics for frequent checkups, and ultimately ensure that the process of delivering a child runs smoothly. Public health midwives also work with doctors who run the clinics and become an essential part of both their local communities and the health system, as they provide an important link between women and its health units.
The civil registration system has played a significant role in Sri Lanka since 1867. The system has been recording maternal deaths since 1900 and has been a key part in organizing and monitoring progress through the collection of information. Through this data, it has helped Sri Lanka in identifying problems and has been a guide in decision-making within public administration. The information aids in identifying, planning, and executing necessary service requirements. Data is collected on each facility by the hospital coordinator. Institutional data then collects the status and availability of basic services such as sterilization equipment, reliable water supply, and blood banks. Sri Lanka has been successful in decreasing maternal deaths by the systematic use of health information and organization, along with access to basic health services and professional midwifery. The essence of health promotion efforts can often be diminished when there is a lack of education. As this pertains to maternal health, a woman's educational levels have been found to be associated with maternal death. There has been a positive relationship between levels of maternal education, health services, and a socioeconomic status. A lack of education can contribute to maternal mortality. Limited money and poor decision-making during pregnancy can lead to negative outcomes. One of the biggest solutions in order to rectify maternal health is developing health promotion initiatives which cater to individual education levels. The rate of adult literacy among women are 88%, as they now contain free access to education until university level because of the increase in age of marriage and births. Health educators are necessary for teaching groups of Sri Lankan women about various aspects of maternal health. They help explain to them the importance of maternal care, preventative measures, healthy eating, and exercises. In the end, health educator addresses issues regarding poverty having an effect on health and how to sustain a healthy quality life.
In conclusion, Sri Lanka's advancements of its health system can be a model for other developing countries that may be experiencing the same hardships. They represent a unique and inspiring story for lower middle income countries. Their success in reducing maternal deaths is attributed to the widespread access of maternal health care, which is built upon strong health systems that provides free services to the entire population, professionalization, and midwife care. They also have better computer systems for health information to identify problems, target quality improvements, and make better medical decisions.